There was a celebration in North Canterbury when the Rangiora Vet Centre opened its new clinic doors to the public. The open day attracted a crowd of thousands keen to check out the new facilities and join in the festivities. Where the crowds go, so goes CTV. I'm Rob Cope-Williams and I'll be your host for this guided tour of the Rangiora Vet Centre.
We run a multi-discipline practice here, so we look after sort of horses, cows, your domestic animals, even through to like Rana Park animals as well. We're very particular about what we stock here. We've got sort of specialised vet-only diets for cats and dogs, through to treatments for parasite control in sheep, horses and cattle. And the vets are very particular about what they stock here. We have a limited range because those are the things that the vets specifically recommend themselves. Everything on the shelves, we know what it is and whether it's suitable for animals, and so that's through to the toys. There's certain toys we won't stock, through to cat collars. There's some that may choke a cat inadvertently, so no, we're very particular about what we put on the shelves here. Ben and Andrew, the partners here, consulted everybody at every stage of the building process, and everyone sort of pooled their ideas, as well as them looking at many buildings to come up with the final result here.
Rangiora Veterinary Centre has just started to become accredited as what's called a cat-friendly practice, which is a scheme that's run by the International Society for Feline Medicine and Surgery. There are several things that we're going to need to do before we can attain that standard. The first thing is that we have a specific separate cat waiting area, no dogs allowed in there. It's quiet, it's screened from the dog waiting area. We've got these lovely blankets to pop over your cages if you're feeling a little bit worried or upset. We've also got some special stands that you can pop your feline friend on so that he or she's at the same height as you and you can look at them. They feel much more comfortable like that. We have what are called feline advocates, which are people who are particularly interested and specifically trained in the handling and nursing of our feline patients. So our aim is to make their trip to the hospital as stress-free and as pleasant as we possibly can. We know that quite a few of our clients really worry about bringing their cats to the vets, and we want to try and take that worry out of the equation so that you can feel confident and happy to bring your cat in here and that they're going to be treated as well as they are at home. We also have a separate cat hospital, which means that they're not at any stage in contact with or can hear any dogs. It's a quiet zone in the cat hospital, it's heated, it's just a very quiet, gentle place to be if you have to come and stay with us for a few days. We also encourage owners to come and spend time with their cats when they're in the hospital too. We love to see them. We love to see them in here helping them with their recuperation and recovery.
It's another diagnostic tool that we can use to look inside an animal. It allows us to do things that other diagnostic tools can't do, like X-ray. We can have a look at some things that X-ray can't view. We can see the soft tissues inside the abdomen, inside the chest, that don't show up particularly well on X-ray. It's very safe. Occasionally sedation is required, but yeah, it's a way of being able to have a look inside without harming the animal. So it's it's very useful tool.
We're very proud of our state-of-the-art, brand spanking new full IDEX laboratory, which is absolutely wonderful for our to use as part of our clinical workups for all cases.
So what are you looking for in your laboratory?
We look for, we use blood samples mainly, but we'll also examine urine for us, and we're looking for we do health checks, so we're looking for problems basically. So we also look for disease states in sick animals. It's really useful to know exactly right away what fluids we should be giving them intravenously, what their actual disease is, what major organs are involved. We do probably 95% here. There are some things that we can't do. The hormones and that sort of thing have to be sent away. They're very specific, but most things we can, which is really great. A great benefit to our hospital patients or emergency cases where we need to know right away exactly what we need to do for them. This is my baby. I spend a lot of time with the microscope. Rather a sad life, my colleagues think, but I absolutely love dermatology, and most of what I do is working with skin disease and samples from tumours and from skin. But also we have all of our vets here and a couple of nurse technicians trained to examine samples that come from wounds and even from urine and from tumours and things, and they look at cells and they look for bugs, and they also, with skin samples, they look for mites. Yeah, we have vast array of lotions and potions and medicines, so our consulting vets are able to just come out here and make up medicines for animals that are in just inpatient in the consult rooms, but also we have a script nurse that works for a couple of hours every morning that makes up prescriptions for all our outpatients when they need their medicines made up. So it's a very nice, pleasant place to work in.
Animal physio. It's the same for humans. You can post-surgical and things like that. They need it just as well as us. It's really good for managing arthritis in dogs and cats. Mostly we do just small animals, so no horses or anything like that. But yeah, it's a really good form of treatment for them for post-surgical. It really does depend on the patient. It depends kind of what kind of surgery they've had. Like say a post-cruciate repair would be about 14 weeks of physio, and that doesn't mean it's like every day of the week. It can sometimes be once a week or once or twice a week, but yeah, usually it does depend on how well they come back from the surgery. We use a laser therapy as well, and a lot of exercises that go with it as well. We do a lot of the strengthening and just getting them back on their feet as quickly as possible.
Kickoff is pure Bundesliga soccer, the real thing, featuring all the games, all the goals, every week. Kickoff, Sunday 12 noon, right here on CTV.
Are you looking for more from your local channel? CTV are online. Our latest listings, on-demand shows, program information, all on the CTV website. We'll see you there.
Hi, I'm Steve and welcome to Carpet Kingdom. At Carpet Kingdom we stock a massive range of carpets, and we're also the largest vinyl stockist in the South Island. And not only do we have an excellent range in store, but you can purchase our stock online. We offer free measuring quotes, we have our own installation team, we ship nationwide, so come on down and see us at Carpet Kingdom. 312 Wilsons Road in Waltham, just off Brougham Street, or visit us online at carpetkingdom.co.nz.
Hi, I'm Mark and welcome to Stay Well Pharmacy. Whatever the season, Stay Well Pharmacy has you covered. As an integrated pharmacy, we stock all the well-known pharmacy medicines, as well as quality nutritional and herbal treatments. Our team of pharmacists and full-time naturopath are here to help you find the products and advice to suit the needs of you and your family. So come in and see us at Stay Well Pharmacy, 27 Shands Road in Hornby. Stay Well Pharmacy, live well, stay well.
You all right, mate? Can you hear me? Hey, you, can you hear me? Can you help me? I need you to call 111 for an ambulance.
If an accident happens and you didn't know what to do, prepare for what could be the longest wait of your life. Know when before you need it. Call 0800 Red Cross and enrol in a Red Cross first aid course today.
Ready to go, mate? Flight leaves at 4:30.
Relax, mate. We'll park at Airpark Canterbury.
Airpark Canterbury, privately owned and operated with a free 24/7 shuttle service. Call 0800 Airpark or book online at airparkcanterbury.co.nz.
Tomorrow Today is your science program, presenting a comprehensive overview of the latest trends in science and research. Tomorrow Today, Tuesday night at 7:30 p.m, right here on CTV.
Master Pet was purchased by the Wooten family back in 1961, and they've basically built it into the multifaceted company it is today to provide pet owners with the services, toys and supplies that they need to ensure their pets have the best life they can. So at Master Pet, we believe that life is better with a pet, and they can't look after themselves, so that's why we exist. The product range, from the foods, the accessories, the beds, the collars, right through to the vet treatments that we do offer, we are doing that to make that quality of life better for the pet and the pet owner.
And you work very closely with veterinarians? Yes,
that's right. Yep. So we've partnered with Rangiora Vet Centre, and we've got 3 reps. So we've got 2 reps that do the accessories, toys, and diets, as you can see. And then we have me, which is, I just work in the farm division. So working really closely with Rangiora Vet Centre to ensure their farmers know that there is a premium diet for their hard-working farm dogs.
The fact that you are here is proof that you're very good, because they vet, if you want, excuse the expression, every product in here very closely.
Yes, they do. So Eukanuba do stock a range of diets specific to breeds, and then we've also got the veterinary specific diets. So if we've got dermatosis problems, and for your old sterilised dogs as well, we've got those diets tailored to their needs.
Tell me about your farm range.
Yes, so we've got our Eukanuba Premium Performance, which is a 20 kilo bag, and they're medium and large breed puppies. So they're a premium diet formulated for the New Zealand farm dog, taking into account their protein, carbohydrate and fat levels, and 100% animal protein added into that diet to ensure the dogs get the recovery and sustenance they need.
So how do you differ from the other raft of people who make claims?
Yes, right. So Eukanuba Premium Performance is a fixed diet, and so the bag you buy today will be exactly the same as the bag you buy in a year's time. So we're guaranteed 100% animal protein, which is derived from chicken and egg. And then we've got a carbohydrate blend, which is to help our farm dogs in their endurance and then their sprint work when they're heading off that mob of ewes. They get up there and they come back and they recover and they can keep going during the day. And then we're also high in fat, so the petrol to make that dog go all day is top quality fat. Yes, so our animal protein, it's 100% animal derived from chicken and egg. And there's really interesting statistic that an animal fed on a non-premium diet is 8 times more likely to suffer a muscular injury. So for the farmer, if we can get those farm dogs onto a premium diet, that's going to reduce the likelihood of their torn cruciate ligaments and general just injuries, and helping them recover a lot quicker to get them back in the working team.
So it's prevention rather than cure, feed-wise?
Absolutely. Their muscles are going to be well conditioned, and like a bodybuilder, they live off their chicken and their broccoli and things like that. Same as our diet, high protein for those dogs to muscle up and have the condition they need to work as hard as they do.
Pricing options?
So we do here at Rangiora Vet Services, we have different price ranges depending on the amount that the customers wish to buy. So we do bulk pallet deals through to 6-bag deals as well. My role as a farm representative means that I will be able to go out on farm for the clinic, meet the dogs, meet the farmers, and we can actually go through a tailored feed plan to make the feeding exercise an economical one.
So you're like a nutritionist?
Yeah, I guess I am. Yeah, and just making sure those farm dogs, they're athletes at the end of the day, they work very hard, and they do require that balanced diet to ensure they can go the distance, as well as have that recovery in the evenings when they get to rest.
And so really you work very closely with the dog owners as well as the vets here?
Absolutely. So we've got our high country farmers where the dogs are going, running up to 40 kilometres a day up and down hills. So they really do rely on that optimum balance of the protein, fat and carbohydrate. And the vets appreciate that quality of diet, because when that dog comes in with a torn cruciate or a broken leg, that high quality protein aspect will enable the dog to recover a lot faster.
And it's interesting that you match the formulation to each individual dog.
Yes, so we've got our standard premium performance, and it will vary how much you're going to feed them given on their work output. So we've got a 30 kilo hunt away after a good day's work. Would be eating about 400 grams of Eukanuba Premium Performance. And again, that's making sure they're getting the right amount of fat, carbohydrate and protein. So when they're back in the kennel at night, it's going to get the recovery it needs.
And if there's a problem, something is brought into the hospital, they've got special feed in them.
Yes, we do. For just your standard breaks and things, the high protein diet will help the recovery with the omega-3 3 and 6 oils. We've got guaranteed levels of omegas, so that recovery will be a lot faster than your other non-premium diets. If the dog has a dietary need, so we're talking about our pets, or they maybe have an allergy, we do have other formulated diets within the Eukanuba range for those.
So you can go out on a farm if somebody contacts the ranger or a vet and says, can you get Georgie out here?
Absolutely, I'd love to. I might even bring Smoko too. So I do love getting out on farm, meeting the farmers, seeing the dogs in their environment, and just being able to chew the fat about what the farmer's doing on a day-to-day basis can help really determine that dog's diet and help them recommend them down a line that will make it economical to feed those farm dogs.
Got a 21-year-old Moggy called Spudsy, and Lee, the vet here, she gives her a vitamin B12 injection every month. And all the vets and the girls know her because she's so feisty.
She's feisty?
Oh, feisty. They come out and say, hi, Spudsy, and yeah. And we've got 2, Leonberger and Black Lab, Pierre and Merlin. And they come here. So
the thing that struck me, because I've had a wee look around as well, and it's the latest equipment and the most wonderful people.
Oh, as I said, they're like family and friends. They come out and greet you, and Sandra, the receptionist, she's amazing with a great sense of humour.
Do you get the feeling that they have a very similar relationship with your pets as you do? I mean,
oh gosh, yes. Yeah, they make a fuss. Like Pierre and Merlin had the health check last week with Lee, and Lee comes and makes a fuss of them, and yeah, and all the girls come out, and yeah, we're just known.
I'm Chris Lynch. Join me for CTV's new current affairs show Lynched every Monday at 8:30 right here on CTV, where I talk to the decision makers and those responsible for running our city.
Hurst Auto Dismantlers, your one-stop shop for all your mechanical and car part needs. Our huge premises boasts a large selection of mechanical parts, panels, tyres and glass. Most makes and models are available on site, and if we don't have it, our trusted staff will do their best to source what you need locally and nationwide. So come in and see the team, or just give us a call and save time and money. Hurst Auto Dismantlers, 343 0099.
Our new companion package is a personalised service for those that need extra help and support. A cost-effective solution for someone who needs more than just a taxi driver. Our drivers are hand-picked from our experienced team and specialise in providing the right support and companionship. Home safe every time with Blue Star Taxis.
Have you seen something you like? You can purchase a copy of CTV's own shows so you can watch them again and again. So give us a call on 3777 033 and order a copy today.
Do you wear an earpiece or earmuffs? Do you have trouble hearing people or the TV? Do you have itchy ears? Then it's time to clear the air. Their gentle micro-suction technique is not only safe and efficient, but it's also performed by fully qualified, trained, registered nurse. Call for an appointment or Clear the Air can come to you. Need earplugs? We have swim, noise or aeroplane plugs and many more. No referrals necessary. Hear every moment with Clear the Air. Phone 0800 Ear Clean.
My son's helped me greatly with my independence now that I've got more mobility.
Mum, I've been looking into stand assist chairs from More Mobility. They recline back with a footrest, then when you want to get out of them, they stand you up. You can even sleep on them. More Mobility can bring one out for a free trial. There's even electric beds too. What do you think? For more range and more expert advice, see More Mobility, corner Clarence and Princess Streets off Blenheim Road.
What a difference more mobility makes.
The world has a great deal to tell. Journalists from across the world report on their home nations and the experiences of the people who live there. World Stories.
We certainly do a lot of different types of surgery here, lots of complex orthopaedic procedures and cancer surgery and abdominal surgery, as well as the more routine procedures like spays and neuters. And we are set up as a hospital would be with a clean theatre, so we're not allowed to go in there without our scrubs on and our masks and our hats, and everything's managed very, very carefully to make sure patients are looked after as well as they can be during their procedure. We manage patients from, we get the odd tiny little thing like a guinea pig or even rats, and a 800 gram kitten right up to 70, 80 kilo big giant bull mastiffs and Great Danes, so it is a wide range of patients. Probably a lot of our patients for orthopaedic procedures are big dogs. They're the ones that tend to injure themselves, lots of working dogs. We do a lot of working dog orthopaedics, ligament injuries and fractures and that sort of thing. They're connected to an anaesthetic machine with a tube in their airway, and they're monitored very closely to make sure that they're safe during their procedure. We use an awful lot of different ways to keep patients comfortable, from medicines that are given before surgery, opiates and anti-inflammatories, to different techniques that we used in human patients like nerve blocks and spinal blocks, epidural anaesthesia. For example, an epidural is always used in a patient who's having any hind limb procedure, so that we use morphine and a local anaesthetic, and that way they're able to get up and walk, but they don't feel anything sort of from their lower back down, so they get the first 18 hours or so after a major orthopaedic procedure pain-free, which really gets them through that initial painful or potentially painful period. We have lots of different ways of delivering those types of medications. We use, as I say, nerve blocks and spinal blocks, also transdermal patches which deliver medications through the skin, and every patient who's having any kind of major procedure will be hooked up to a fluid drip which also carries, as well as fluids to support blood pressure, pain medicines as well. So yeah, we don't like them to be sore. They're probably a little bit sedate sometimes, and probably enjoying their recovery a lot, a little bit spacey sometimes, but they're monitored very closely. If a patient's a little bit upset, we'll have a nurse sit with them while they're recovering and make sure they're comfy. We're all a bunch of softies, so we like to see them looked after as we'd like our own pets to be looked after.
We're really lucky. We've got a whole set of new equipment right from processing machinery, and we can view it all on the digital monitor, which is just great. We're able to do that, and we can get a quick answer as to what's wrong with your pet. It's very safe. We have to be very careful with x-rays. They are dangerous. They're a form of radiation. So we wear our special x-ray badges to ensure that we don't receive overdoses. And obviously we only take the minimum amount of x-rays required to make a diagnosis. So we're not overexposing your pet either. We're very lucky here. There's lots of vets, various different levels of experience. We also, externally, we can refer the x-rays to specialists and experts that are able to take that diagnostic process a step further and give us an answer, the best answer as to what's up with your pet, and better still what we can do to fix it. It's a human grade machine, very, very similar process. There's not too many differences there, other than we tend to have to sedate the animal to keep them just a little bit stiller on the table, because they won't just lie there when we ask them to.
We do procedures where bacteria are likely to be aerosoled into the air, so we obviously don't want that in our sterile surgery where we're going to be opening body cavities, and we really want things super clean. So we do things like wounds, abscesses, ear infections, dental surgery, things like that where there's more bacteria involved. Often the time that we do pick up dental disease is when they come in for their annual health check and vaccination. And the owners have been completely unaware that their pet's teeth are in the shape they're in. So you can lift the lip on your pet and check for signs of redness in the gums, brown staining on the teeth, bad breath. But there's lots of ways that you can prevent tartar as well, and so we always talk about that at the annual health check too, to make sure that they're staying as healthy as we can. Bad teeth or periodontal disease, which results from infection in the mouth, causes a number of things. Firstly, a lot of pain for the animal. They don't necessarily show that pain, but we all know what it's like to have sore gums or an abscess in your mouth or a broken tooth or a dental cavity. it causes pain for our animals as well. And so dealing with that obviously improves the animal's quality of life. And when you think that the tartar and periodontal diseases on the inside of the teeth as well as the outside, there's also quite a lot of probing and work to be done to get these teeth back to the state they should be in. So we need to anaesthetise or knock out our animals. We don't always see something. As I say, they have very good protective mechanisms so that they don't show us pain, but they might paw at their mouth or drool at the mouth. When they rub their face along the floor, be less happy to eat. They might even be more antisocial. One of the other important things about having bad infections in your mouth is that that infection can travel through those inflamed gums and go to other parts of the body. So it's actually quite a major health issue for them as well. That bacteria can deposit in the kidneys, the liver, even the heart lining. So it is quite serious. And there's one other thing that is very obvious to me, but not always obvious to other people, is that having bad breath can actually seriously impact on the pet owner bond. You know, you have a dog come to you with a smelling breath, they tend to get pushed away because they're not pleasant to be around. So getting rid of the tartar, allowing those gums to heal, makes that dog much more attractive, or cat, much more attractive to their owner, and so they tend to get more love and cuddles and kisses and things that, really make having a pet nice.
Our tour's not over yet. Next time we'll complete our walk around the centre with a look at the large animal facilities. We'll see the equine facilities.
We've got the rest of the business, the surgery over there, so our in-house lab for testing all our bloods and bits and pieces is all over there. Most of our other gear though is all portable to the fact that we can operate it over here, so our x-rays, ultrasounds, shock waves, all the other machinery and things, equipment can be used over here, but we have got the backup of the big mothership over there to help us out.
And find out more about how the vets work with Arana Park.
If we have to operate on a lion or a tiger, we actually anaesthetise them and bring them out here and operate on them here. Because with Auckland and Wellington Zoo, a lot of those zoos have a dedicated clinic and surgery. And now I think Auckland's cost them about 16 million, and I think the Wellington, the nest, is about 9 or 10 million. And Arana Park just haven't got the funds for that. So we actually anaesthetise them, bring them out here in a secure trailer and put them into the clinic and operate on them there.
That's next time when we return to the open day at Rangiora Vet Centre.